Hello, this is Melissa Barszewski for Colorado Christian University and Healthcare Law and Accreditations. This is my Session 1 presentation on Joint Commission and CMS. In this session, we will be reviewing the following questions, including the relationship between the Joint Commission and the Centers for Medicare and Medicaid Services, also known as CMS. We'll also discuss what it means to have a Joint Commission Medicare deemed status, and we will be reviewing how notification of the accreditation survey is relayed to CMS. So to begin with, there has been a long history of interaction and collaboration between the Joint Commission and the Centers for Medicare and Medicaid Services. Originally founded in 1910, the Joint Commission has always had a goal to establish minimum standards for hospitals and provide a path for standardization. When the Social Security Amendment of 1965 was approved, it included language that certified hospitals for Medicare and Medicaid programs that passed Joint Commission accreditation surveys. Eventually, CMS would be granted some oversight to JCAHO by allowing the Secretary of Department of Health and Human Services to validate their findings. Throughout the decades, JCAHO would expand their certified accreditations from hospitals to skilled nursing facilities to psychiatric and ambulatory care centers and many others. The mission of JCAHO is to continuously improve the safety and quality of healthcare in the United States and the international community through the provision of education, publications, consultation, and evaluation services. JCAHO's collaborative approach with CMS has also spawned a program called Speak Up, which encourages patients and their caregivers to be advocates in their own medical care. Our text raised the possibility of a conflict of interest between the Joint Commission and the hospitals they survey. Before delving into that deeper, it's important to note that Medicare is a significant source of funding for U.S. hospitals. One Kaiser Family Foundation study claimed this could be as much as 24% of overall hospital reimbursements. Having Joint Commission accreditation allows hospitals to engage in procedures that would allow for Medicare and Medicaid reimbursement, thus improving revenue for the hospital system. A hospital accredited by CMS-approved accreditation program may substitute accreditation under that program for survey by the state survey agency. Surveyors assess the hospital's compliance with the Medicare Conditions of Participation, or COP, for all services and areas and locations covered under the hospital's provider agreement of their certificate of number, or their CCN number. Earning the gold seal of approval from Joint Commission is a visual logo that a hospital has successfully completed the certification process and is deemed worthy of Medicare and Medicaid recipients. The Joint Commission is a nonprofit organization that charges healthcare institutions for the surveys. As Posgar writes in our text for this week, quote, "How credible can a survey be when the accrediting body is dependent upon the organization it surveys for financial survival?" End quote. While this is true, the Joint Commission has a readily available Code of Conduct policy, in which it states principle number 1 is legal compliance. And within that principle, it expressly discusses adherence to all federal and state antitrust laws. Even still, there are concerns that the Joint Commission isn't unbiased when it comes to accreditation. In a series of expose articles, author Stephanie Armour reported through the Wall Street Journal that despite numerous safety violations, the Joint Commission continued to accredit hospitals. It is unfortunate that there are questionable motives exhibited by an accrediting entity that is relied upon to report safety in healthcare institutions. Healthcare leaders should do all they can to assure that they abide by regulatory laws and ethical standards. The accreditation process is long and arduous. One application guide discusses 7 important steps before the accreditation process even begins. The surveys themselves are a comprehensive review of the facility's organization, financials, processes, leadership, quality control, patient rights, and human resources, just to name a few. They last a minimum of 3 days, with industry experts reviewing department specifics and interviewing staff and sometimes patients too. Recertification generally occurs every 3 years. Once an institution has successfully completed their survey, the road continues. The organization will receive approval from a board of review. This letter is also forwarded to the regional CMS office and the State Department of Health. The state will confirm the institution still meets criteria for Medicare eligibility, and then CMS reconfirms all paperwork through the fiscal intermediary. Once this capitalization letter is completed, CMS will verify that the entity is operating at the physical address before awarding a CMS certification number, also known as a CCN number. This process could take 4 to 5 months after the survey. The journey is still not over yet. The next step requires the institution to get a submitter ID, which becomes their billing number. The process for the submitter ID is very similar to the CCN number. However, this will also include electronic data interface, or EDI enrollment for billing purposes. This process may take an additional 2 to 3 months after the CCN number is received. In conclusion, there is a long history between the Joint Commission and the Centers for Medicare and Medicaid Services. The goal of the Joint Commission is to establish standards of care and protect patient safety, and those are very honorable. These align well with the expectations of CMS for payments to providers under the Social Security Act of 1965. Unfortunately, as with all organizations, there may be conflicts of interest that undermine the integrity of the institution. As leaders, it is our responsibility to not only demonstrate righteous behavior, but to examine the organization for anything that is not in alignment with those standards. Will we be able to say, as David did, "Test me, Lord, and try me, examine my heart and my mind"? More wisdom can be found in Proverbs 27:17. Iron sharpens iron, and one man sharpens another. The process of accreditation is difficult, but it helps to achieve the highest standard of care for our patients and holds institutions accountable to these best practices. Although it is a long and tedious process, if we expect this of ourselves and of one another, we all succeed. Thank you for listening. Blessings on your journey.